Radiation has many special advantages compared to other modalities. It's very localized. We know a great deal about how to use it in terms of controlling tumors as well as sparing normal tissue around the tumor. And it has the advantage of rapidly inducing cell death, which triggers the release of potentially neoantigens that may reset the immune response of the host against the tumor. So tumors escape the immune system by somehow making the host tolerant to their growth. And I think if you are capable to cell death, and particularly immunogenic cell death, a type of cell death that is sensed by the immune system, to re-alert the immune system to reject the tumors, you participate very actively in some form of immune rejection and in the outcome of the patient.